Hi, I'm Steve Adubato. More importantly, everything you ever wanted or needed to know about heart health, you're about to find out. My good friend and colleague, Michellene Davis, Senior Vice President of Policy, Governmental Affairs, Barnabas Health, and Chairwoman of the American Heart Association's Northern New Jersey Go Red for Women's Luncheon. Good to see you.
Good to see you too.
You are wearing red.
I am.
I got my red tie. This is big. By the way, we're doing this program in the beginning of February 2013. This will air after this luncheon on February 28th. It isn't just the luncheon that's important, it's the message behind it. This luncheon is the Northern New Jersey Go Red for Women Luncheon, American Heart Association. You're the chair. Talk about it. Why is it so important?
Oh my goodness, it's so important for so many incredible reasons. But I have to tell you that Barnabas Health is just thrilled to be able to partner with the American Heart Association in order to actually do this luncheon and to bring this premier event to Northern New Jersey. There is another luncheon in Central Jersey, but this is the 10th anniversary of the Go Red for Women initiative with the American Heart Association. Steve, during that time, during the last 10 years, we have been able to save an estimated 627,000 lives, right? That's 330 less deaths per year for women who are suffering from heart disease, the number one and number 4 killer of women in the United States of America. So very excited about this opportunity.
Why do you think, Michellene, that women and heart health had been ignored for so long?
Interesting that you asked me that. I think that a great deal of it has to do with, quite frankly, just the progression of our times. I think that initially lots of clinical trials involved only men. Men were really pretty much the barometer, and that unfortunately delayed the ability for science to catch up with the changing evolution of women and our bodies, and the fact that our symptoms of heart disease and heart attack and stroke often present very differently than they do in men.
How so?
Well, for one thing, you know, most folks are familiar with the fact that you expect to grab your chest and feel some type of tingling down the left side of your arm, and women have that occur too. But Steve, most of the times, many women, unfortunately, fail to seek emergency services or dial 911 when they're having a heart attack because we just assume that it'll pass. Right? Oftentimes, yeah, absolutely. We decide that, you know, getting the kids off to school is more important, making certain that our husband has his lunch prepared, ensuring that we make it to work in time for that meeting is so much more important, and that if we're having shortness of breath, some slight sweating, right, becoming a little dizzy, that perhaps is either something that we ate or just the fact that we're moving at the speed of light rather than the fact that we're actually having a cardiac episode. As a result of that, you know, science has now begun to really focus in on the special relationship of women to their heart and our bodies. And as a result of that, we're beginning to be able to diagnose and save so many more lives than we have traditionally.
Now, this program is not just really about that luncheon. This is a program on air after the luncheon it'll air several times. That is why the website, we have a couple websites up, the goredforwomen.org site, which is obviously tied to the American Heart Association, our partner in this initiative, and the Barnabas website as well. Lots of important information about heart health.
Yes.
And I'm curious about this. Where did the Go Red piece come from? Because it's a great, not just slogan, but a great campaign that people buy into. Where did it come from? Do you know?
I always like to say because they realized that red was my favorite color. But the truth of the matter is the fact that it was really a conscious objective to raise awareness among women, right? And quite frankly, with the men who love and cherish us as well, right? And so as a result of that, the American Heart Association simply wanted to ensure that there was an ability to convey the importance of just heart awareness to this particular population. Today is the 1st, and as you know, it is Wear Red Day. So I love the fact that you have on your red tie.
Well, I knew you were going to be here.
Thank you very much. I appreciate that.
Do you think, now we're doing this on the 1st,
please.
do you think that in terms of awareness, I mean, we're doing every program, Hurricane Sandy hovers over everyone in this region. So many programs, we're taping lots of shows over a couple of days, so many programs, even if they're not about Hurricane Sandy, the subject comes up. To what degree has that changed the focus and the awareness of this Go Red initiative, because that other initiative is there? Meaning, how many fewer people are wearing red, are thinking about Go Red? does it get, quote, in the way? I hate to put it that way, but there can only be so many causes at one time, right?
Interesting that you say that, because the truth of the matter is, and I know that this show is going to air after the
Sure.
luncheon actually takes place.
Because the cause goes on, the problem continues.
Absolutely, and unfortunately women continue to die of heart disease every single day. So the fact of the matter is that towards the end of the year, one of the things that we noticed, unfortunately, was the fact that so many corporate entities, which traditionally serve as chief sponsors for this type of event,
That's where the money comes from.
Absolutely, it helps us to do the research, to do the education, to do the outreach. Unfortunately, because they were impacted so severely with
By the storm.
Sandy, absolutely. They wound up utilizing so much of their budget in order to actually come to the aid of their own employees. Listen, Barnabas Health did it. I mean, we actually did a tremendous effort. As you know, we have 3 hospitals along the South Jersey shoreline, and as a result of that, we have upwards of 400 individuals who were actually displaced from their homes. We absolutely wanted to ensure that we were answering the call for our employees, but Steve, I'm going to tell you this. One of the things that experts in the behavioral health industry will tell you and convey to you is the fact that oftentimes after a national tragedy like this, after an individual is so completely impacted by the trauma of a Superstorm Sandy, what we see is the fact that many, many months after that, they continue to suffer from the stress of that episode. Well, unfortunately, stress is a big indicator that leads to oftentimes having a cardiac episode.
Stress and heart
Absolutely,
issues are directly connected.
Hand in hand. So as the behavioral health
So
community
interesting.
begins to absolutely prepare for what we know to be the 6-month to 9-month sort of aftershock of having to deal with the breadth and depth of having lost everything that you own, you know, we also have to understand that we need to be aware, concerned, and vigilant about what that means for heart health for the individuals that we serve as well. So absolutely, right? The cause continues long after the luncheon. This is just in order to make certain that we are highlighting the importance of ensuring that this cause remains at the top as a priority for so many
And by
individuals.
the way, Merck and Macy's are jumped in here, right?
Absolutely. Merck and Macy's are the national sponsors for the Go Red for Women initiative.
Always want to make sure to plug those folks.
Thank you.
In the time we have left, real quick, why did you get into this?
Why?
Yeah.
I
Because there are a lot of a lot of causes, a lot of
Yeah,
opportunities to do. I get a minute left. Why?
No, please. So just personal, anecdotal,
Yeah.
as well as clearly professional, right?
Sure.
So you know my role is as policy and governmental affairs with Barnabas Health. One of the things that I also have the wonderful advantage of doing is shepherding our community benefit initiatives in the communities that we serve, right? American Heart Association is one of those partners, and we are a significantly committed corporate social responsibility partner. Having said that, on the personal side, Steve, African American women die more from heart disease than any other group of women in the United States of America. This is our call to action.
That's why we have Michellene Davis, who is Senior Vice President of Policy, Government Affairs at Barnabas Health, and also the the chairwoman of the American Heart Association's Northern New Jersey Go Red Luncheon for Women, which is on the 28th of February. This program will air after because the cause continues. It is great to work with you, and we appreciate you coming in.
Thank you so
You
much.
wear red, very nice.
Thank you.
I got to find a red suit. Stay with us. We'll be right back on One-on-One right after this. Thank you, Michellene.
Thank you.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the New Jersey Education Association, working for great public schools for every child. Investors Bank, Barnabas Health, PSE&G, committed to improving New Jersey's economy and strengthening its communities. New Jersey Manufacturers Insurance Group, auto insurance, homeowners insurance, and banking under the principle of stewardship. The law firm of Gibbons PC. Horizon Blue Cross Blue Shield of New Jersey, making healthcare work. And by Cohn Resnick, providing accounting, tax, and advisory services for more than 90 years. Promotional support provided by the Star Ledger and NJ.com, Everything Jersey. And by NJ Biz, All Business, All New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.